Okay, so great to have you with us. And this panel we called Women's Health. Whole food plant-based doctors discuss how to prevent and reverse chronic illness, autoimmune disease, arthritis, and other women's health issues. And I think the Real Truth About Health conference has focused a lot about heart disease, diabetes, cancer, Alzheimer's. And I'm 58 years old and my wife is 57. And in the last few years, she's complained to me that there's all these things that are different in her life, physically, emotionally, mentally, sexually. And she feels like, how come no one told her? She feels a little like, why is no one talking about this? Why is no one talking about this? And she feels a little like the things that are happening to her, she feels a little bit isolated, like she didn't know that this was normal. And she's been going to different people, different doctors. And she's starting to now realize, like, wait a minute, this is very common and there's not something wrong with her. Things are changing. And she kind of feels a little like, why haven't I been told exactly what's going to happen? So I hope that to some degree, one of the things we'll accomplish tonight is to just speak to women of all ages, but certainly those in their 30s and 40s, to let them know a little bit more about what it's like, and to women in their 50s and 60s and 70s about the best way to handle this. So I look forward to trying to move forward with this. So I am going to ask you questions, but before we do that, if each of you could just take 30 seconds to tell us your name, your latest book, or if you have one, and just what you've been doing the last 20 years so we can get a little more familiar with you. And I guess we could start with Dr. Goldner and then Dr. Rahman.
Thank you so much. You know, what you just said reminded me of a conversation I had with my best friend in medical school when we both had children. Why didn't we learn anything in medical school about how much breastfeeding hurts, right? She was the lactation consultant for her hospital, and we didn't know that as doctors. We had no idea. We had to learn that ourselves. So I definitely think there is a need for more discussions about what it's like to be a woman that's separate from what we learn. My specialty is more towards actually optimizing your immune health. So for those who didn't see my talk, I'm someone that had, I had lupus nephritis. I had antiphospholipid antibody syndrome, which meant that I had lupus attacking my kidneys, causing blood clots, strokes. I had a very difficult time with my health as I was also becoming a doctor. And 16 years ago, I reversed my disease completely with my nutrition protocol. I saw some shout out to my smoothie shredders. Hey guys, they all know about my nutrition protocol, which actually optimizes cellular function and optimal immune health through an intentional overdose in nutrients that are used by the body for those reasons. And we've been able to replicate those results in thousands of people all over the world. Some are giving me shout outs here, and reverse things like lupus, mixed connective tissue disease, scleroderma, Sjogren's, MS, as well as things like diabetes, high blood pressure, heart disease. So what I really try to do is spend my time educating and inspiring people that it is possible, it is not difficult to do, and that it's important to do. I'm also an expert in trauma and trauma resilience. And so what I try to teach people is that if we do take charge of our emotional health and we feed and nourish our bodies as well as our spirits correctly, then we can have good health and we can have a great life even while we're struggling with our health. And that's really what I try to do. So my most recent book is Goodbye Autoimmune Disease. And in that book, I talk about not just the nutrition for reversing disease, but the mindset and the emotional health necessary to optimize your happiness, which also optimizes your healing.
Thank you.
Hi, everyone. I'm Dr. Rahman, and I'm a board certified OBGYN. And I can so relate to your wife because I think we're sold a false bill of goods. We think that the vital years are in our 20s, and by the time we get in our late 30s and 40s, it's all over. It's all over, menopause, find a corner, and just shrink. And the reality is that women are becoming their most vital and most vibrant at this point in your life. You've experienced things, you know things, and hopefully you have the health to allow you to enjoy life. And so from a gynecology perspective, I find that the GYN issues start to become prevalent in the 30s, 40s, 50s, and beyond. And so this is the time to optimize your health, not only for midlife, which can be fantastic, but for the years beyond that.
Okay, great. Thank you. Okay, so first question, and I guess you could both answer any question, and you can also pass on it if you feel like it's not something you focus on. But the first question, let's just stay with my wife and I for a moment. So I'm 58, she's 57, and in the last few years, my hormones have changed. I am less hormonal. My sex drive is lower, but it feels appropriate, but clearly lower. And her sex drive at times has dramatically dropped, combined with that sex feels painful and vaginal dryness. And so it's a whole system of a combination of she feels some shame, she feels she's going to disappoint me, she feels a little embarrassed, and she feels like there's something wrong with her, like she's like there's something wrong, like she's, and then she whispers to a couple of friends who whisper back really quietly, I'm going through the same thing, my husband and I aren't really having sex, and when we do it hurts. And it's a little bit of confusion. And I guess I'm concerned that there is like this shame, not that there should be shame, but that she feels like certain shame, like somehow she's a woman, she's supposed to be sexual with her husband, and she's not feeling it. And on the other hand, I feel a responsibility as a husband to be the most supportive I've ever been in the relationship. And even if my sexual desire exists, to be really compassionate for what she's going through. And I could see that a lot of relationships could have a problem, because if a man thinks that he's entitled to sex, which he's not, but if he has that mindset that it's expected, and a woman, and I'm stereotyping that it's the man and the woman this way, it could be the reverse, and the woman is feeling like her body's changing and this is not really what she's feeling, this not only does it physically create issues, but the connection, there could be issues between them. So maybe you could help just sort out what I'm saying. Tell me if some of this sounds familiar. What do you think's going on? What wisdom do you have to share? What's normal? And also throw in, what's the best way you think for men to support women if they're changing?
Wow, that's a lot.
Sorry.
That's all you.
Sorry.
That's a lot, because when you talk about sex, that's a hot topic. That's a very hot topic. And the reality is most women don't talk to the gynecologist about sex. And the reality is most gynecologists don't talk to their patients about sex. So it's this thing that never really gets discussed, but everybody wants to talk about it. In terms of your wife, the changes are real. I mean, there are hormonal changes that go along with the perimenopause, menopause. You have declining estrogen levels, and that doesn't go unnoticed. Vaginal dryness can be something that results as a result of the declining estrogen. But there are other things like decreased libido. I just don't have an interest. And so there's multiple factors, and it varies from person to person, couple to couple. You have to find out, is it a physiological issue that you can address? Is it a relationship issue that needs to be addressed? Is it related to life in general? Sometimes life gets so hectic and so stressful that one of the things that's easy to expend, to do without, is sex. You know, you have to pay your bills, you don't have to have sex. I mean, so it becomes something that you're willing to forego. I think the one thing that couples need to be able to do is talk about it, okay? Because you don't know the expectation of your partner unless your partner will speak to you. The other thing is that most women mourn the fact that it's not like it was when I was in my 20s. That's true, but that doesn't mean it can't be wonderful, it can't be fulfilling, it can't be satisfied. I sometimes use the analogy of a fine wine. It's had time to season. There are flavors, there's nuances that you have with your partner, and a certain level of intimacy that is not just about the physicality of the moment. It's about a number of things that come together and form this very rich bouquet. So I think that it is possible to have a wonderful, satisfying, invigorating sex life. It may take some discussion, it may take some vulnerability in that you have to say, I don't feel this, or I would prefer this, and then you go from there.
Okay, thank you. And do you want to just comment one time also about how men should best support women who are going through this? What is the, again, I would hate to, I wouldn't want a man to take it personally that thinks his wife doesn't like him because she's withdrawing or she has a lower interest in sex. I wouldn't want a woman to feel judged because she doesn't want to. How could a man be most supportive to his partner in this situation?
I've heard it both ways. Some women just tolerate it in order to satisfy their partner. Some men lose interest because they have erectile dysfunction or some other problem. I'm saying probably the easiest way to deal with it is to acknowledge that things are different and then look for what brings me pleasure. How can I pleasure you? And then you go from there and you make it something that's not stressful, but a relief, because now we're on this new discovery about, does this feel good to you? And if it does, we're going to do more of that. If it doesn't, we're not, or we're going to find another way to make ourselves enjoy each other. And so it's a way to, it's an opportunity actually to rediscover your partner.
What I would add to that also is, I think the way you deal with this issue is how you deal with every issue in a marriage, which is communication, right? I mean, you've got to talk to each other. My husband and I have an amazing marriage, and we talk all the time, every day, every single day, about everything, from how much we love each other to any issues that we have. I mean, it's just a constant flow. And so maybe the issue is going to be sex, but maybe the issue is going to be something else. And if you can't express to your partner when you're uncomfortable, then you've got a bigger problem than sex. You've got a problem with communication. I don't know any sexual partner who would want their partner to participate in pain to please them. I wouldn't find it pleasing to know that my partner was suffering while we had sex. The whole point of sex is communion, not just finishing, but a communion and a sharing of love and pleasure. And so I think we do need to focus on that aspect as well, that if there's an issue here, there's an issue. And if you communicate, I agree with Dr. Rahman that it can still be beautiful, and maybe it will be different, but at least it will be a shared experience, which is what sex is really about, at least with a partner.
The other thing I heard you say is that we don't really know where to go for help. And that's a real issue, because you end up doing things like Googling or reading an article in a magazine and not having the answers that you may be seeking. And that's where you have to be fairly proactive. I mean, just like you would with any other issue. You need to, if it's the female and the problem is vaginal dryness, pain with sex, she needs to see her gynecologist, and she needs to bring up the issue. She needs to speak up for herself. If the issue is libido, you need to talk about that. If it's relationship, you need to talk about that. If it's her partner, sometimes men will not want to own up to the fact that things are different for them too. And so all of these things have to come out. You have to, if it's a priority in your relationship, then you'll seek out the help that you need. you should seek out the help that you need.
Thank you. Okay, before we move on to the next question, Dr. Rahman, your mic is a little fuzzy, so our tech person is going to try to see if we can get it a tiny bit clearer.
Okay.
John?
I think he took her to a breakout room to work on
okay.
it.
Got it. Okay, so the next question is, what is autoimmune disease and how do you heal from it?
That's definitely for me then. So that worked out.
Yes.
Okay, so autoimmune diseases in really general terms is when the part of your immune system that is normally involved in protecting you, right? So if you get a virus or a bacteria, there's an inflammatory immune system that goes out there to seek out, destroy, and protect the host, right? That's the real goal of immune function, is protecting the host. So in autoimmune disease, for many reasons, which I can get into, the immune system stops functioning properly. And instead of attacking only invading bacteria, viruses, et cetera, it starts attacking one's own tissue. And there are many different types of autoimmune diseases, although I see them really as the same because of they're started by the same things and they're reversed by the same things, but the symptoms really are related to what antibodies you have. So for example, when I had lupus, I had antibodies at first that caused me arthritis and rashes and kidney failure. And then later on ones that caused mini strokes, which was it was still lupus, but with a new antibody, right? Other people with rheumatoid arthritis, they might generally have more joint pain and disfigurement and fatigue, but not other organ functions, scleroderma in the skin, MS in the nervous system, but it's all the same pathway of the immune system turning on the host body because of really confusion created by chronic inflammation. And chronic inflammation can really take over that inflammatory response. And that is caused by many things. One, which I focus on a lot, especially in Goodbye Lupus, which is your nutrition. Two, your levels of stress and happiness and your sleep levels. So all these different things contribute to this chronic inflammatory state, which can then trigger disease, whether it's heart disease, diabetes, or cancer, or autoimmune diseases. So the other part of the question was, what do you do about it? Well, we go after all of those things. So I have a very specific protocol that we developed back when I reversed my lupus 16 years ago. We thought it was just a fat loss protocol that was going to increase my metabolism and make me have my dream physique. It worked, but at the same time, for the first time in 12 years that I'd been sick, I had normal kidney function, I had no blood clot antibodies, and I had no lupus antibodies. My cholesterol went from over 200 to 150. This was in 3 months. So we realized, especially after I had my first son, that we had done something and we had to test it and understand it. And that's where our hypernourishment protocol came from. So we use an intentional overdose in the nutrients your body uses for cellular repair, because we have damage to work on, and optimal immune function, right? And that involves things like cruciferous vegetables in their raw state, omega-3 fatty acids. I like using flax and chia for that, and adequate hydration to allow all these processes to take place. And then for some folks, that's all they need. They hypernourish, and within weeks to a couple months or so, they can't believe how great they feel, right? For others who struggle, often there's an emotional component, trauma, depression, anxiety, all of those are inflammatory. So much so that there have been some doctors that suggested we give prednisone to people with depression. I do not recommend that, but we do need to work on healing the emotional wounds. So for example, I was actually really happy today because I have a rapid recovery group where I work with people every day. And today I was reading over people's logs, and we're just finishing the 5th week. And we have multiple people say that this was the happiest they've ever been. This is the first time they haven't had anxiety. 5 weeks after changing their habits, not only around nutrition, but around how they talk to themselves and their self-care. And when we get the emotional health where it needs to be, then recovery is even faster. You add in a good amount of sleep and you see the kind of rapid results we've been able to get in people. So if you're struggling to get better, make sure you're looking at all those different aspects of your life to make sure that they're all aimed towards getting better health.
What are the diseases that make up autoimmune disease?
Oh my gosh, there's so many. I could be here all day. The most common ones that we see: rheumatoid arthritis, lupus, scleroderma, Sjogren's, multiple sclerosis. There are a lot of people, Hashimoto's is probably the most common, actually. I take that back. So autoimmune thyroid disease, although Hashimoto's is not treated by rheumatologists. The main reason being in Western medicine, the thyroid is considered disposable because you can replace it with a pill. So people with Hashimoto's aren't usually put on immunosuppression. However, when you don't treat the underlying autoimmune disease, which is not done in Western medicine, those people usually go on to develop rheumatoid arthritis and other kinds of autoimmune because they still have ongoing autoimmune even after the thyroid's destroyed. So that one's really the most common, even though it's not usually treated as rheumatological. But those are the ones that I see most commonly, as well as people who haven't been sick long enough to be diagnosed as rheumatoid arthritis versus lupus versus Sjogren's. And so instead they'll be called undifferentiated or mixed connective tissue disease, which really means you have some signs or symptoms of multiple, but we don't know which one it is yet. So it's kind of like a umbrella diagnosis.
So how many people in the United States have autoimmune disease?
You want me to pull up numbers? You're gonna have to give me a sec.
Just
it
to
is
try
a
to
growing number. It's a growing number every day. And there's actually, it used to be something that was fairly uncommon. When I had lupus at 16, we didn't know anybody that had lupus. It was so rare and so unusual. Now everybody knows somebody who has it. And I was recently just talking about a study that they did where they were looking at why is it that autoimmune diseases are increasing rapidly all over the entire world. And now in countries where they never had autoimmune diseases like Crohn's and ulcerative colitis, now they have them, like in the Middle East and in Asia. And so some geneticists tried to figure out what is it that's happening? Is human genetics changing? Because it's believed in Western medicine that autoimmune diseases are genetic. So if we're having more autoimmune disease, human genetics must be changing, right? That was the purpose of their study. And what they found was human genetics have not changed over the past 30, 40 years. That what they did find, though, is that the rise and spread of autoimmune disease is exactly mirroring the rise and spread of the Western diet. And so it really was just more information that shows what we've been saying all along, is that if you eat the Western diet, you will get sick, whether you just, watched Neil Barnard talk about diabetes or you watched Esselstyn talk about heart disease. The Western diet is causing all of this. And as well as causing autoimmune diseases, although they haven't been discussed as much, except maybe by me, as being a primary trigger for developing these diseases rather than purely genetics, as it was believed before.
So how possible is it to cure an autoimmune disease, and when does it become not possible?
So I'm always really careful with words like cure because they turn people off. If you say you can cure lupus, someone else will say, no, I looked on the website for the Lupus Foundation and all this stuff. It's incurable and therefore you're blah, blah, blah. Not going to listen to you. So I talk about disease reversal because while you can argue whether or not I'm cured, right? I had lupus for 12 years. I have not had lupus for 16. Am I cured or will it come back? I don't know. Right now, all I know is that for the past 16 years, I've felt extraordinary. I'm 45 years old. I feel better than I did as a teenager, right? So I think we have to be careful about those words because they really upset people and get people out of where they need to be, right? But these diseases are reversible. What you cannot argue with is that someone has a disease and the symptoms go away, then we are reversing it, right? That is something where people cannot pick on the words with me because it's absolutely true. We reverse the progress of it, and then we reverse the symptoms of it. We reverse the labs. So I went back to a state that shows that I have no disease currently. And I think that's probably true with everyone, right? If someone with type 2 diabetes becomes a vegan marathon runner, they're not going to have type 2 diabetes anymore, right? But if they instead switch to a Western diet and stop all exercise, could they eventually get it again? Of course, right? So I look at it in terms of disease reversal. And from what I have found, and I've worked now with thousands of people all over the world with many different diseases, that we can reverse these diseases. Now, there's a difference between reversing the disease and reversing all of the symptoms. And that really depends on the person and their health, how much damage was done, for example. So I've published reversing end-stage kidney failure, and the people that were on the, someone was on a transplant list, got off the transplant list in 6 weeks, doubled her kidney function using nutrition, right? My protocol. Now, she didn't go up to normal kidney function, right? She went up to double what she had. And then we hit a plateau because she'd had 9 years of lupus attacking her kidneys, and there was sclerosis or scar tissue. Same thing, I had someone in my recent rapid recovery group, 2 men with lung disease, one from autoimmune disease and one from COVID. And the one with COVID was on oxygen, got off of oxygen, but he didn't have normal lung, right? He couldn't run without needing a little bit of oxygen, right? So he didn't need it for everything. So we reversed it, but not back to normal yet. The other man at 5 weeks, he was on the lung transplant list and was kicked off the lung transplant list because his lungs were too healthy for transplant, but they're still not as healthy as my lungs, right? So as far as how much recovery you can get, really that's going to depend on how much damage you have and how much is scar tissue versus healthy tissue. But we can eliminate those antibodies. People with Hashimoto's all the time, they get rid of those antibodies, and we know they don't have Hashimoto's anymore. Some of them get normal thyroid function back, and others still need medication because the damage is already permanent. So no matter where you are, it's always worth doing because you're going to optimize your health, you're going to optimize immune function, and it'll make you more resilient. You know, I was just on the news talking about cruciferous vegetables because I'm their vegetable lady on all the news stations, but the Johns Hopkins just did a study showing that cruciferous vegetables cuts the RNA replication of COVID and cold viruses in half, right? So it's still worth it to eat this way, even if you can't get rid of every symptom that you had because of long-term damage. You can optimize your immune function and still live a healthier life the best you can have.
Thank you. Welcome back, Dr. Rahman.
Thank you. I feel like I was being censored. I was talking about sex and then I got.
Well, he only asked me about autoimmune disease while you were gone, so you missed nothing.
Okay.
We missed you though.
Okay, so next question, either of you can answer it or whatever you like. What is menopause? When does it start? How long does it last? What are the physical and emotional changes that women most commonly experience during menopause? Is there any way to minimize or eliminate the uncomfortable parts of it? And how does this affect women's weight?
These are very intense questions. They're not simple answers. I think I should go back and just very briefly touch on the physiology of it all. If you can understand the physiology, then it starts to make sense. Women are born with all the eggs that we will ever have at the time of birth. At puberty, these eggs start to, these eggs start to mature and develop, and our hormone, our major female hormone, estrogen, starts to increase. And the estrogen levels remain high during our reproductive years, 20s, 30s, 40s. Right around 40, we start to deplete all of the eggs that we have, and our hormone levels start to decline. The estrogen level starts to decline. As a result of the declining estrogen level, we start to experience symptoms. The first symptoms that women will typically say is they notice that their menstrual cycles, which have been very regular, are now starting to become irregular. The other sign associated with early menopausal changes are hot flashes and night sweats. We've all heard about hot flashes and night sweats. These can be mild, or these can be very dramatic. I use the analogy of how women experience their menstrual cycles. Some women have no cramps, sail through their menstrual cycle, no problem. Other women have severe cramping, they have to go to their bed. And so it's variable for women, but the reason for it is the declining estrogen level. As the estrogen level drops, all of the receptors in our body, estrogen receptors, start to respond. So we have estrogen receptors in our hair, in our skin, in our breast, all over. They can also, we can also experience changes because of the declining estrogen level. Once the estrogen level is sufficiently low, we stop having a menstrual cycle. And we use that as an indirect, stopping the menstrual cycle as an indirect indicator of menopause. Now, menopause is because we depleted all of the eggs in our ovaries, but not having a period is a secondary effect of that. And so we say, if you have gone a year without having a menstrual cycle, and you are of the menopausal age, meaning that if you're 20 and this happened, that would be abnormal. But any woman over the age of 40 who experiences this, we say this is consistent with menopause. And so anything a woman can do that can help to elevate the estrogen level will help to relieve the symptoms of a decreased estrogen. And so a lot of times women consider hormone replacement, which is different from the hormones that a woman might take if she was using contraceptives. They're both estrogen and progesterone hormones, but birth control levels are much higher than what women would take if they're just doing a hormonal replacement.
Thank you.
I hope that's clear. I mean, there's a lot to take in, but it's a physiologic process. It's not, my concern is that we not think of it as pathology, meaning this is a normal physiologic process. And there are things that women can do that will make it easier. And it kind of depends on your symptoms. There's a recent study that was published in the Menopause magazine, which said that if women followed a vegan diet and supplemented that with a half cup of soy, menopausal symptoms were alleviated. And that's one thing that women can do. Women find if they exercise, if they cut back on alcohol, if they do things like find the peaceful space, do meditative type responses, they can help to ameliorate any symptoms they may experience during menopause. So it is a change, but it's not necessarily bad. And not every woman needs a pharmaceutical in order to get through menopause.
Thank you. Okay, next question. So in terms of multiple sclerosis, what works for this? And is I guess is MS treatable? And I've been told that when it comes to Parkinson's, Alzheimer's, Lou Gehrig's, and multiple sclerosis, that once you have them, then it's too far gone. For people who have MS and are doing okay, they're still walking and everything, but they take drugs occasionally when they have an episode, how much hope do you want to give them? Is there a lot of hope, or is this just, like you'll feel a little better? Like what do you want to say to MS patients about how much progress you believe is possible?
First of all, there's a lot of hope, and there's always hope. I work with a lot of people with MS, and I have seen people go from barely able to move to running. There's Sarah Ramos, if you're here, she posts on Instagram pictures of her doing like mud runs and 5Ks now, where she could barely move when I met her. She did my rapid recovery group and she thrived, and she's out there sharing it with the world. And that's what's really cool about people who heal, is that we become health missionaries. We can't wait to share what we did and how well it worked, because we want you to feel like we did. I've helped people. I've had one person with Parkinson's do rapid recovery with me, and he was able to lower his medication dose within 4 weeks. And his friends and family noticed visible reduction in symptoms that returned once he added back his standard diet. He actually did it as a favor to his neurologist who wanted to test my program. And ALS has been one that's come up a lot. And I've always said I'd love to work with someone with ALS to find out, because here's the thing, I will not speak to theories. I will only speak to results. And I hadn't had anybody with ALS do rapid recovery where I could watch them and monitor them and make sure that they're doing things correctly. And in our previous group, I'm hoping she'll let me share some of her video, because we do Zooms and I have videos of her talking. She actually had reversal of ALS symptoms, and we were all crying in the final meeting, because it was the first time we got to work with someone on that level with that illness. And to see them come back was just, it still brings me to tears, because that's a disease where there's not a lot of hope given at all. So as somebody who spent a lot of my life sick, I think it's always worth it to do everything you can Listen, I was told that I'd be disabled in my 40s. I'm 45 and I feel amazing. I was on the cover of, Fit Over 40. I don't really care about that part as much as my body works. And I was told it wouldn't, so I still think it's worth doing everything you possibly can to take care of yourself. And if it's just going to slow the progression, or if it's going to bring you back, then it's still worth it, right? So sometimes I do see people where they're already in a wheelchair and they've got really serious issues going on. And I'll tell them, I don't know if we're going to get you walking again. It really depends on, if say there's still inflammatory lesions, or if these lesions are already set, and that's going to be a disability you already keep, but we're going to prevent the new ones, right? But I have had 3 people now retake MRIs after doing our rapid recovery group, and all 3 of them had no new lesions and regression of the most recent lesion. And in every single case, the doctor that was reading, the radiologist that read the report said, maybe it wasn't a real lesion, maybe it was just a mistake, because those lesions don't go away. So that was also really exciting, as we, while most people don't get them often, we did have 3 people who tested and saw that result. So we do know, even looking at MRIs, that this disease is reversible, and at least the most recent lesions can possibly get better, and you can stop the progression, which is really, really important in diseases like this.
Thank you. We touched.
Oh, wait, check this out. Look, Diana just wrote in the comments, MS in remission for over a decade because I added hypernourishment, which is my protocol, and she regained her full vision back. So there you go, from the seats out in the audience. It works.
Great, thank you. We touched on this, but for women who feel they need it, do you recommend 1 hormone replacement therapy, 2 bioidentical hormone therapy, or 3 neither? What is your general thought on this for women who feel like they need something?
It depends on the woman. It's a situation where you have to tailor it to the woman, her needs, and her personal preferences. There are some women who have a great fear related to taking estrogen, progesterone. And partly that's due to the media and the thought that it would increase your risk for breast cancer. There's some women that are in the total opposite extreme who come in actually asking for it. And what we have to deal with is the issue of quality of life. Similar to MS and other conditions, we are really talking about how do we live life in a way that's optimal for us. And so there isn't a cookie cutter answer to that. It really has to be tailored to the woman. And so I have women who are taking estrogen and progesterone. I have women who are taking progesterone only. I have women who opt not to take any hormonal replacement. The issue with bioidentical kind of came about because, how can I say this? I think the obstetrician and gynecologists kind of were dismissive of women and their symptoms. And then Suzanne Summers came out with a book and she started talking about bioidentical hormones. And the thought was that if I take a bioidentical hormone, it's not going to hurt me versus the hormone preparations which have been given to women. The number one being Premarin. Premarin is a hormone that's derived from the urine of pregnant horses. And so the question is, why would I want to take the hormones from a pregnant horse? I'd rather have a bioidentical hormone. And women started gravitating towards this. The American College of OBGYN has said that there's no proven benefit of bioidentical to synthetic hormones. Most women don't buy that, quite honestly. And so the problem with bioidentical is that often, because there weren't preparations for that, women had to have these medications compounded. And the problem with compounding these medications is there's no regulation, there's no guarantee that you're actually getting what you think you're getting. And so for that reason, the emphasis was placed on, no, you should use pharmaceuticals which have been approved by the FDA, because then you know exactly what you're receiving. Just recently, there's now a bioidentical hormonal preparation that's been put on the market that doesn't involve compounding. I say all to say that it's been a mess, and it's been a lot for women to comprehend and to take in. But the bottom line is, first of all, do you need hormonal replacement? And that's dependent on your symptoms. And if you do need them, what makes the most sense for you? Do you want to take a pill? Do you want to take a cream? Do you need something solely for the vaginal area? And all those things have to be factored into the equation, which is why I say the answer is it depends and has to be tailored to the woman and her symptoms.
Thank you. This question is for men and women. A lot of us are very concerned about heart disease, and we take that seriously. We don't smoke because we don't want lung cancer. And we're concerned about diabetes because we want, our pancreas, we want to be protected. What do we need to know about our thyroid? This is kind of like we'd rather not have to worry about another thing. Is this something that we have to take care of? Are we supposed to be thinking about this? Is this a real issue that a lot of people have? Every now and then, I'm usually not thinking about it, and every now and then someone says something about the thyroid, and I start thinking, is this something we're supposed to know about? So are we supposed to be knowing, thinking, doing anything about our thyroid? Anything to say about that?
Well, I think that you don't have to think about all your separate parts when you're taking care of the body as a whole. So, a lot of times people want to know, what's the best diet for heart disease versus diabetes versus autoimmune disease? And there is an optimal diet for human health, right? And when we take care of our health by eating in the optimal way, everything is better, right? So I haven't had to, while I do specialize my protocol for people who have impairments that require it, right? Like I've reversed Crohn's disease and ulcerative colitis, but in those folks, I often have to take a stepwise approach because they can't stop with the diarrhea and bleeding. So we can't just feed them the way I'd feed someone else, right? But the optimal protocol that we're aiming for is the same. Same thing with kidney failure. If you can't process your food properly and your potassium is going to spike, I have to change it. But it doesn't change what the optimal diet is. We just had to change it based on your current organ function. So for the thyroid, it's going to be the same thing. And so I've helped people reverse both Graves and Hashimoto's using the hypernourishment protocol and plant-based diet, and they get healthy. The one thing that does need to be paid attention to in thyroid disease is iodine intake, something that I discovered a few years back. I was trying to figure out why all of a sudden I'm seeing the surge in people who have symptoms of thyroid issues, even without any antibodies. And what is going on here? And so I was obsessing about it, and I realized something. I realized that a lot of the folks that I see have been they are people who are trying to search out health, and they're Googling and they're, learning about it. And one of the things that comes up a lot is there are people who say all salt is bad. So they stop eating all salt. And then others who switch to sea salt, and neither of those have iodine. So a long time ago, they started adding iodine to salt because it was something that all people ate. And it was an easy way to deliver this nutrient that's important for brain function and thyroid function. Now people are suddenly not consuming it. So over recent years, I've actually brought that back to people to pay attention to that because they will start they'll eat the healthiest they've ever eaten. And then suddenly their hair is falling out, their skin's getting dry, and it's because they gave up their iodized salt. And so it's actually impacting their thyroid. So I do actually encourage people to have some sodium in the diet because I'm also hypernourishing with high hydration. So if you're drinking 96 ounces or more water a day, you actually need a little sodium to have your blood concentration be steady. But if you're going to use something like your Himalayan special pink salt, whatever, you are going to then also need something for iodine, either 2 sheets of dehydrated nori a day or an iodine supplement. And the range that had been shown to be effective for thyroid health for the general person, about 150 micrograms a day. For people with Hashimoto's, 300 micrograms a day, but not more. The studies have shown that if you go higher than that, you actually cause more problems rather than help it. So that's one thing I would add to just an overall healthy diet and way of living, is to make sure that you do get that supplement in your body one way or another.
I would also add that hypothyroidism tends to increase in its incidence with older women. And so older women need to have their thyroid function checked. And a lot of the symptoms of hypothyroidism, hot flashes and night sweats, mimic these changes that we think are associated with menopause. So you may be calling one condition, diagnosing it incorrectly, thinking that it's menopause, but it might be related to your thyroid.
That's a super good point. You know, that happened to my mom. I was actually only a resident at the time, so I didn't know all I know now about nutrition. And she felt depressed and she was gaining weight for the first time. And the doctor kept saying it was menopause. And it turned out she did have menopause and she had Hashimoto's at the same time. So yeah, that is definitely something that happens for sure. And that happens a lot in general. The thyroid disease can show up in a lot of ways. And sometimes the first symptom is depression or anxiety. And people will be sent to the psychiatrist rather than checking their thyroid levels. So I do think it's an important thing to check for, in addition to just taking care of yourself in every way.
What should women 50 and older do to avoid weight gain? What should they eat or not eat? Yeah, that's it.
Well, I can definitely touch on this because as I mentioned before, you know, the initial protocol that healed me or reversed my lupus back in the day was a fat loss protocol. So I know some of you guys know my husband, Thomas Tadlock. His obsession coming out of his master's in exercise science was really, what is the optimal diet for human metabolism? Why is it some people, you know, have a slow metabolism or fast metabolism, they can gain muscle or lose fat and other people can't? And so he was obsessed with optimizing nutrition for the human body because it frustrated him that when he was getting his classes from his PhD professors and he'd say, what's the optimal diet for metabolism? They would go, I don't know, some high fat, low fat, high protein, low carb, everyone's different. And he'd go, what are you talking about? That's not science. Biologically, we are the same. You know, there's very little different from human to human in terms of our mitochondria and other organelles and all of our different enzyme systems and nutritional requirements. So I have learned a lot about human metabolism. And what we learned together is metabolism is not only a measure of how quickly you can burn fat or build muscle, but how quickly you can recover from disease, how quickly you can repair your body. So metabolism is really a function of cellular health. So I don't really see aging as a cause for weight gain. It is that people become more malnourished over time, which then affects cellular function over time. So I'll give you an example of that. I learned in medical school that you know, the kidney function goes down as you get older, and that's just normal, right? Just like we also learned that every prostate will eventually get cancer if the man lives long enough. But what I found doing my work is actually every person that I hypernourish, even if they're 80, their kidney function goes up even when it wasn't in failure. That I've had people in their 80s whose kidney function went up to normal when they came to me to deal with some other issue like their rheumatism. So we know that a lot of the issues people have is really malnourishment over time or doing things that damage the metabolism, right? So before I did this, I used to do, you know, slim fast shakes and things like that in my 20s where I'd go, I want to fit in that dress for that party. So I'd, you know, eat nothing and drink horrible stuff and I'd lose the weight. And then the moment the first bite of pizza hit my mouth, like my love handles would come out again, right? So we also damage our metabolism over time by malnourishment and abuse of the body. So what we do, and we have had a lot of women come to us and say, you know what, the reason I can't lose weight is because I'm 60, I have a hypothyroid, and I'm postmenopausal. And those folks lose fat at the same rate as everybody else does when they hypernourish themselves and exercise. So when we replenish the nutrients that we're missing from the cells, and we add the right kind of exercise, because sometimes people don't do the right exercise with the right diet, right? They're eating they're doing like slow weights, but they want to lose fat. You know, you got to do high intensity interval training or other things that get your heart rate up, right? So, so when you hypernourish and add the exercise, you will get, one, optimize your health, your organ function, right? And you will get that metabolism working again. And what we find over and over again is people say, yeah, I did this for, some people do it for fat loss, but then their organ function gets better. And other folks come to me because they're literally dying of organ failure and other problems, and all the fat falls off quickly too. So metabolism is a super interesting topic that's very poorly understood. But I've gotten lucky enough to live with someone who lives and breathes metabolism. And I think it gives a lot of hope because especially with women who are older, a lot of them have given up that it's possible for them to get a fast metabolism. I'm fitter at 45 than I ever was before in my 20s when I worked out every day, but I eat so much better and my body is so much healthier. My mom, for the first time in her life, got abs at 60 years old, postmenopausal, Hashimoto's, and she lived with us. So she got to do our program living with us. And she went from a size 12 to a size 4 in 4 months and got her first belly ring at 60 years old. So to show off her belly. So it is absolutely possible.
I think the problem is expectation. I think too many of us think that we're supposed to gain weight. We will eventually become hypertensive. We will develop diabetes and we'll probably end up in a nursing home. I think expectations are such that we eat in a way that doesn't nourish our bodies. And so I think the primary thing is that we need to change people's expectations about what is possible with their health. And when we do that, we can see changes. And people then become more willing to do those things. I mean, life becomes hard after a while. And one of the few pleasures in life is eating. We eat for all reasons. We eat when we're happy, we eat when we're sad, and to take that away from people and not have something that's equally satisfying becomes a real challenge. Changing someone's diet and how they live may work short term, but for the long term, people don't want to give that up. And that's a real issue that you have to evaluate with people. When the holidays come, how do you deal with that? When you go out to eat, how do you deal with that? All of those become really important issues when we're talking long-term sustaining weight loss and what you need to do and how you can stay on board.
That's really important. I mean, that's one thing that I talk about a lot with folks is that changing your diet is not just about knowing better, right? It's about addictions, traditions,
Absolutely.
self-esteem, and your environment and all those things. So a lot of it's interesting that oftentimes in order to get people to really switch with a change in lifestyle, I've got to work on their self-esteem. Like somebody asked me, how do I say no to dessert? That was in our smoothie shred group today. How do I say no to dessert? So, well, first of all, you decide that you are worth having the life you want, no matter what anyone else in the room is doing. 2, you let people know around you how important this is to you and ask them not to tempt you. People, if they don't know better, they're going to do that, right? And 3 is just say no, thank you, right? That you're allowed to have more. Like I could eat whatever I wanted, and I probably will stay healthy for a while because I'm so well nourished. But if you give me the choice between eating anything I could eat and risking being sick again, or eating the way I do now and having everything I want in the world, there's no competition. So a lot of it comes from here to say, I'm not missing out if I'm eating a salad versus a pizza. I am missing out if I am sick, disabled, and not able to do all the things I wish I could do. So it does take a whole lot of work here and here. And that's why those of you guys who know me, that's so much of what I do, because the nutrition's easy. It's getting this on board. That's the hard part,
And you find that so many people, when they become ill, they're willing. They're willing to change their diet, willing to do whatever it takes. And then when they feel better, they want to go back to the way things were. And that's the problem, because they see the past and our old ways of eating as optimal. There needs to be a change in the mindset where you now see that this is what it takes to stay healthy, and that it's not a punishment. It's not a negative, it's a positive.
Yeah, it's kind of like smoking, right? I mean, when I was a kid, there was everybody smoked. All my parents' friends smoked everything, right? And my parents they quit smoking when the news about secondhand smoke came out. And they went, okay, we can't do that to her. We like her. Let's try to stop, right? So they did that. But in the beginning, they were the annoying ones. All their friends were smokers, and they're going, you guys got to quit. You should go to our hypnotist. You should do this. We should quit smoking. They were the annoying, weird ones, but they stuck with it. And eventually all of them did too. And so it's okay to be weird. I always tell people, what's weird? Getting healthier as you get older. That's weird, right? Being being disease proof is weird. Not getting colds is weird. Be weird. I'm really weird. Be weird, right? But also know that just by living the way living the right way, you're going to inspire others along the way too. So, you know, if a smoker had COPD or lung cancer and recovered, I would hope they wouldn't go, man, is it time to go back to cigarettes? I've been missing them. I didn't smoke for 2 months. I'm ready to go back to smoking. We got to start looking at the foods that got us sick instead of looking at them romantically. Like, I can't wait to go back to that bad relationship, to say, thank goodness I'm out of that bad relationship. I can't wait to see all the better stuff to come. So again, it's all here.
And we have to think about the addictive quality of foods. I mean, with sugar and all those other additives that are placed in foods, and understand that our food is manipulated and contaminated. And so we need to optimize it in any way we can.
What are fibroids? Who gets them? How common are these? What causes them and what cures them?
Ooh, your questions again. Fibroids are benign tumors that develop within the wall of the uterus. They happen to women globally. When a woman is symptomatic with fibroids, she will often complain of abnormal bleeding, excessive bleeding, or she will complain of pain. We do not know what triggers a fibroid to develop, but what we do know is that fibroids tend to grow during our reproductive years when we have high levels of estrogen. Until relatively recently, the treatment for fibroids was surgical, meaning that either you would have a hysterectomy, removal of the entire uterus, or you would have a myomectomy, where you would remove the fibroids to keep the uterus in place. There are other options now available to women. Fibroids has been a particular interest for me because it's very prevalent in African-American women. African-American women tend to develop them at an earlier age. We tend to be more symptomatic. We tend to need surgery. And as a result of needing surgery, we also tend to have more surgical complications because of large fibroids. Studies have shown that correcting vitamin D levels tend to help to reduce the size of fibroids. And African-American women tend to have low vitamin D levels. Nutrition. We also found that there are the chemicals that are ubiquitous in our society, the EDCs, these chemicals which are hormone-like, which can then feed the fibroids. And so the problem is that we live in a society where we're exposed to excessive amounts of estrogen or estrogen-like compounds, and possibly for African-American women, more so than most. And so we need to limit that. We need to change our diets, and we need more research.
Thank you. Which nutritional supplements do you recommend for adults? And are there any special ones for women that they should take?
I recommend for all people that they take vitamin D and B12 and that they test their levels. It's really important. Sometimes almost everyone I've seen is deficient in vitamin D, and depending on how deficient, often a loading dose is necessary. So I recommend people test it if they can. B12, same thing. That's something that's important that people keep up on. So those are two that I tell everyone to do. Usually a good probiotic is important when you're changing your diet. A lot of people realize that very shortly, especially trying something like hypernourishment, that when you go from almost no fiber to high fiber, a lot can happen, either too much too fast or not enough. So usually those three together can really help people. Although probiotics, they don't need to take forever, but usually at least for 2 to 6 months while they're transitioning their gut. Sometimes I will, based on the person, add other things depending on issues that they're having that are personal to them. But for most people, those are the three. And of course, as I mentioned, making sure you're getting iodine in some way.
I personally don't recommend vitamins much because I don't want to give the message that the answer is in vitamins. I believe that the answer is in nutritious food. Now, granted, our foods may not have all of the nutrients that we need, but we need to switch the focus. I don't want women coming in telling me they're taking a slew of vitamins, they're taking a multivitamin, they're taking sea moss, they're taking probiotics, they're taking all these different vitamins. I would rather them spend their money in getting organic, nutritious food. That being said, I do believe that we need to supplement with vitamin D and B12 if we're following a vegan diet. But I would prefer to focus on the food and not the nutrients, because the interactions of these vitamins and nutrients is way too complex. And I think we oversimplify what they do in our body.
Oh yeah, it'd be amazing if we could just give people a vitamin and they wouldn't have to eat all the foods, right? But it doesn't work. What I found is actually in both people who eat standard diets and in people who eat plant-based diets, that D is a universal thing they need, and B12 a lot of people still need regardless of diet. So like I said, I think it's a great idea to just test those things, because then you have your answer of whether you have enough or not, rather than trying to make it up. But all the other vitamins, 100%, you want to get those from the foods, wrapped up in the food that it came in, right? With the fiber attached to it. That's how you want to get it. And vitamins and minerals are going to come from plants. Minerals especially come from plants that are deep in the soil. So that's why vegetables are super important.
What is urinary incontinence? How common is it, and what can be done about it?
So you have a pelvic floor, and the pelvic floor supports the uterus, the bladder, and the rectum. And as we get older, or as a result of childbirth, you can start to lose, there can be weakness of the pelvic floor. And when there's weakness of the pelvic floor, there can be loss of support. Urinary incontinence is, there's a couple different types of urinary incontinence, but stress urinary incontinence is related to the fact that you don't have that support. So whenever you cough, sneeze, walk up steps, laugh, try to exercise, you can have loss of urine, which is different from urge incontinence. Urge incontinence is like that commercial that you heard, when I gotta go, I gotta go. That's urge incontinence, which is different from stress incontinence. Stress incontinence, when you cough, sneeze, and then you have some leakage. The treatment for the two are very different. And so part of the thing that women need to do is they need to go in and have an evaluation to determine which type of incontinence do I have, or do I have a combination of the two, and then address that. But that being said, all women should try to strengthen their pelvic floor. It doesn't matter what age you are. A strong pelvic floor will help with sexual enjoyment. A strong pelvic floor is needed after delivery, because that whole second stage of labor, when the baby is fully dilated and the baby's coming through, those muscles are being stretched and pushed apart to allow for the egress of the baby. So postpartum, you need to work on strengthening your pelvic floor. And when you get older, you need to work. So there's never an age when a woman doesn't need to work on strengthening her pelvic floor. The problem is, a lot of times you don't know how to do that. And it's hard to figure out exactly where is your pelvic floor. I mean, you can't see it, you can't really touch it. Hard to discern. It's not your abdominal muscles, it's not your gluteal muscles, pelvic floor muscles. The one thing that women can do, that's a test to see if they can identify their pelvic floor muscles, is if they can stop the flow of urine. If they can stop the flow of urine, then they are contracting their pelvic floor muscles. Those are the only muscles that can do that. So that's the test. I don't recommend that you do this all the time, but that's the test to know, have you identified the right muscles? And then there are all sorts of devices that you can use that can help you to strengthen your pelvic floor, but it's definitely something that women need to pay attention to. And I would say it's something that gynecologists usually don't discuss with women enough. Usually we only start discussing it either after childbirth, momentarily, or when she comes into the office complaining of incontinence. And there have been studies that show that when it's early incontinence, We're just starting that, doing these type of exercises. You may have heard of Kegel exercises, help.
Thank you. What kind of gut problems do people come to you with? What causes gut problems and what is the solution?
Yes, that might be for me. So, gut problems are pretty prevalent in general. And I think one of the disappointing things I've found in the medical world is that it's not addressed even in gastrointestinal doctors' visits, how food impacts gastrointestinal health. It's always shocking to me when a gastroenterologist will say, "Oh, food's not important." I go, but that's the only thing in physical contact with your gut. Of course it's important, right? And we do know that that's an important component. So I think some level of gut issue is pretty dominant in people in general. There are some people who think that our gut health is the key to the health of things like our immune system. I'm very hesitant to say cause and effect on anything, because I find that when we talk about conclusions versus results, we usually get led astray. My husband and I were just having this conversation before I came on, that if people would read a study and just read the results instead of the discussion and conclusion, they'd be better off, because the discussion and conclusion takes you the wrong way. So oftentimes you'll see ideas like leaky gut associated with autoimmune, but did they develop autoimmune and leaky gut at the same time, or did one cause the other? I don't think that matters. We work on both things. So I found when people eat really optimized plant-based diet, especially when we work with people on hyper-nourishment and plant-based diet, what we find is that gut health gets better. Sometimes though, they feel more symptoms at first, because again, if they're not used to fiber, suddenly that's a very new thing, and that could cause all sorts of problems, gas and bloating, some constipation if their gut's weak, or some will be going multiple times a day, which I actually don't mind. As long as it's out, it's out. But those are the most common things we see, is people complaining of bloatiness, gassiness, and worry about the looks of their stool. I wish we could cancel whoever created the meme that says like what poop's supposed to look like. I have not found it to be the case that poop needs to look a certain way in order for someone to be healthy. It looks differently depending on what you ate. If you drank smoothies all day, you're gonna have green mushy stuff come out, it's gonna be very different, but that doesn't really matter. What matters is the internal health of your body. But that's what I see people most focused on. I have helped people reverse anything from IBS, both like irritable bowel symptoms, which we work on a combination of mood and diet for those folks, because anxiety is a huge component for most folks with irritable bowel. And then for inflammatory bowel diseases like ulcerative colitis and Crohn's disease, those folks present differently. Oftentimes they have blood in the stool. They can have terrible constipation or terrible diarrhea. It just depends on the person. And in those cases, I have to work with them to get their gut healthy enough to then be able to give them the nourishment they need to reverse those diseases.
And also, we talk about the microbiome of the gut, but there's bacteria in the vagina, and that's a normal thing. And a lot of times you can control the vaginitis, the bacterial vaginosis, the yeast, by controlling your diet.
Oh, there's one other thing I wanted to add too. Most common problem that people, a very common problem that people use a lot of pharmaceuticals for, is constipation. And the primary cause of constipation is not enough fiber and not enough water. Right. And a lot of times I've helped people who've had constipation for 20 years or more, who have had to have surgeries because of rectal injuries from constipation. And no doctor before me ever asked them how much water they drank. And we just add the water intake. And those of you who see me on stage, I actually act out what it's like to go down a dry water slide. That's just, it's very hard to get down, right? You need to like lubricate that slide. And when people get their water intake up, they're able to have normal bowel movements, and they never knew that before. So water intake is important. And by the way, the other thing that dehydration causes is constipation, fatigue, and headaches. Think about how much money people spend on caffeine and medicine for headaches and medicines for constipation when water intake was their main problem.
Okay. We touched on this already, but do you want to comment again, go into any further details for women? How does sexual health change as they age? Do you want to comment on that further?
So sexual dysfunction is actually very prominent in women premenopausal and postmenopausal. And I go back to the fact that we're not really talking about it. We're Googling it, we're looking in magazines, maybe we're talking to a girlfriend, but it becomes a very personal issue. For younger women, a lot of times it has to do with low libido. For older women, there's also low libido, but in addition to that, there are the symptoms related to menopause, and that's often vaginal dryness, pain with sex. And so actually of the two, the menopausal symptoms probably the easiest to treat, meaning that you can give an estrogen cream to the vaginal vulva area, and that will actually improve the moisture. And what happens is, when you think about it, it's pretty remarkable. The vagina, the beauty of the vagina is that it's elastic. 6, 7, 8-pound babies come through the vagina. But with age and with menopause, things can start to become restricted. And that adage, use it or lose it, is really true. For women who do not engage in sexual activity for an extended period of times, things can start to constrict. And for those women, often there are devices called vaginal dilators, which are available to them that helps to start to stretch out the vagina. There's estrogen cream that you can apply to that area. So there are things that you can do if the symptoms are related to menopausal type symptoms, atrophy. In terms of libido, that's actually a little more complex. We say that if the issue of libido often involves how you think about sex, expectations, relationships. There are medications that are now currently available to women to help with libido. They're not fantastic, but there's something, whereas we had nothing before. Men had Viagra and men had Cialis and women had nothing. Now there are other medications that are available to women that they can use. That plus, I'm a big proponent of CBT, cognitive behavioral therapy, possibly getting a sex therapist, talking to the gynecologist. You need to make this known because there are options available to women.
What does the science say about preventing bone diseases such as osteoporosis? You're muted, Dr. Goldner.
I didn't want to disrupt the brilliant information you were getting with my noises. Okay, with osteoporosis, it's a very common issue, and there's a lot of factors to it. When I've worked with people in reversing it, what we really work on is optimizing the diet. So you got to eliminate things that are going to cause bone loss. Animal products, especially dairy, will do that. But when you're looking at rebuilding bone strength, one, you need really good nourishment, and two, you need strength building exercise. The combination of those two things will build up bone strength. And that's something that everybody should be doing. Of course, those things are good for all things. Kind of goes back to what's good for one part of your body is good for all of them. But we've had people reverse osteoporosis, osteopenia, doing hypernourishment, plant-based diet, and strength building exercise. It really does make a huge difference.
We touched on this already, but do you want to say anything more about what is abnormal bleeding for women? When in a woman's life does this happen?
That's a great question. That's a really great question because, quite honestly, women don't often compare the amount of bleeding they do with each other. So how do you know what's normal? I have a story of a woman that ended up in the emergency room with a hemoglobin of 4, very, very low, because of heavy bleeding. And they said, "Did you not talk to your gynecologist about this?" And she said, "Yes." "Did your gynecologist not ask you about your periods?" And she said, "Yes." My gynecologist asked me, "Was my periods normal?" And I said, "Yes, they're normal. I always bleed like this." And so abnormal bleeding is if you bleed more than 7 days, too much. If you need to change your pad every hour, too much. If you find that you're doubling up a pad, a tampon, and some other device, that's too much. If you feel that there's a of flooding or gushing associated with your menstrual cycle, too much. And if you've been told, otherwise healthy female, and you've been told that you're anemic, odds are you're anemic because of heavy menstrual cycles. So women should check their CBC, complete blood count to know whether or not they're anemic. And if they have any question about, is my period normal, they should follow up with their gynecologist.
Okay, so what is the basic plan for what is the hypernourishment plan? What is the plan, the basic plan of that you tell the average person with the average health issues as the core non-negotiable things that for the rest of their life they should be doing daily? What is the plan, the program, the diet, the lifestyle? What is the 5-step plan? What are the main things you are saying to people of the specific action steps to put this all together?
6 steps, and I taught it for 2 hours on Thursday. So if anybody missed that, please go and watch the whole presentation, because I really got in there with all the details and answered all the questions that we could. So hopefully you guys are looking at that. But if you want just the cliff notes, so if you're looking, it really depends on your current state of health, how aggressively you want to change it, right? Or to go after diet. For all people, I think that hypernourishment needs to be a part of the diet, because most folks have been malnourished for most of their lives. You know, I was talking to someone today, someone happened to call the office line, and I picked up because I had to be in here today for things. And she started talking to me and immediately made 2 wrong conclusions that I had to fix, right? And one of them was, I was eating a diet of meat and all this stuff, and my health was perfect. And then one day it wasn't. And I said, no, it wasn't. There's no chance of that. And then she needed bypass surgery for her heart. I said, that didn't happen overnight. That was the buildup of everything that you had done, especially nutritionally, to your body. And it finally culminated in the symptoms that you experienced. So it wasn't like you tolerated your diet all that time and then it suddenly came out of nowhere. This is already the issue that you've been having. You finally became symptomatic. So if we want to undo those problems, then hypernourishment is the key, because again, it's going to provide nutrition that your cells really require at higher dosages. Because if we have, the estimate is about 100 trillion cells, and all of them are holding open little cups that say, please, may I have some more, please? You know, if you just have a little cup of smoothie or an apple, you're not going to refill all of those cups. You're going to suffer, right? So one of the reasons why my husband and I are known for getting people feeling good so quickly is because we hyper-nourish. So what is hypernourishment? Hypernourishment is, again, the intentional overdose in the nutrients your body uses for cellular repair in the immune system. So one important component is getting enough vitamins and minerals for all the cellular function to happen. What's the highest dose of vitamin and minerals that you can get? Comes from cruciferous vegetables mainly. Spinach is also a good one. All the things people prefer to see as a garnish over the main dish, you know, like kale and broccoli and cabbage and all of those things. So we want to get we want to use cruciferous vegetables because they are so potent. And we've been testing either metabolism or health for, Thomas and I realized today, about 2 decades. So what we found is the raw version of those work the most effectively and the most rapidly. You need to get the omega-3 fatty acids up. People were asking me when I was giving my lecture about, you know, why would someone need to have so much flax and chia? And it's because they are deficient in omega-3s. Omega-3s only come into the body through diet. So, and the other problem is because we need to have a balanced ratio of omega-6 to omega-3. Omega-6 comes from animal fats and oils and processed foods. So people don't intake omega-3 and then they intake tons of omega-6, and that results in chronic inflammatory issues. So we try to quickly replenish that. And that is going to be useful for, one, optimal immune health, because your anti-inflammatory immune cells are made of omega-3 fatty acids. You must have them to have an anti-inflammatory immune response. And 2, they're going to integrate into your cellular membranes to create the metabolism you want. So your metabolism is really the speed at which your cells can communicate, take in nutrients, and release toxins. So if you don't have omega-3 fatty acids in your membranes, then you're not going to have a high metabolic rate. So we have found, and we've tested this, I mean, like I said, 20 years now, we were looking at how much omega-3 can we give somebody and when do the benefits stop happening? And we couldn't find an upper limit. The upper limit is when they can't stomach anymore. But for hypernourishment, a handful a day, if you're a healthy person, flax or chia seeds is a good start when people are looking for aggressive change in their health. Like when they work in my rapid recovery group or other programs, I'll start them out at a half a cup a day. If their gut can handle the fiber, maybe a few tablespoons of cold pressed flaxseed oil. If they cannot handle the fiber and need a more lubrication down that bowel, or they're too bloated, for example, but that's the omega-3 part. And then hydration. Water intake is essential for human health. And they found even water alone, being dehydrated, ages our organs more quickly. And while people can see if their skin's aging more quickly, they don't realize that it's aging their internal organs as well. So even though I've been healthy 16 years, I still got that water bottle with me. This is my gallon jug, but really getting that water intake up if you're trying to change your health to 96 ounces or more, depends on your weight. All right. So for humans who are 100 pounds or more, they can usually tolerate 96 ounces to a gallon. But if you're really a lightweight or you have issues with your kidney function or hyponatremia, use less than that. So you got to be a little careful there. If I don't know you, I can't pick your water amount. But those are the components. And so if you're eating any diet, you can add hypernourishment. Even a terrible McDonald's diet, you can add hypernourishment. And I recommend it. It's actually, that's my gateway drug into eating healthy is hypernourishment, especially our green smoothies. I see our shredders are there. We call our people in our free Facebook group smoothie shredders. That we found that if we can put all of those ingredients into a blender and then add some frozen fruit for flavor, they will drink those ingredients down even when they won't fork it in. So if you make a green smoothie where you put in, 75% spinach, kale, chard, whatever greens you like, handful of flax or chia seeds, fruit for flavor, that's a spoonful of sugar to make the medicine go down, put water in there and blend it up. If you can drink that by the end of the day, no matter what else you eat, you're going to be better off metabolically in terms of your ability to fight disease. Like I said before, cruciferous vegetables are actually antiviral, right? In a much better way, no side effects, right? Except maybe glorious bowel movements. So there's a lot of benefit to any diet. The sicker you are, the more your diet needs to come from those kind of ingredients. So I saw somebody in the comments, I think it was Diane, by the way, congratulations, who reversed her MS, eating hypernourishment and a plant-based diet that had some cooked plant-based foods as well. For some people, that's all they need to get to that result. For others who are extremely ill or just need a faster timeline, we will focus on pure hypernourishment until their symptoms are gone and then add back things like cooked foods. So like I said, it's always a good time to add that to your diet. It's something I will keep forever because it gives me so much health and vitality. I love it so much. But depending on the state of your health, you don't necessarily need to restrict as much. It really just depends on what your goals are.
I say you have to start wherever they are. Too often, too many people are eating ultra-processed foods. Ultra-processed foods have an extraordinary amount of sugar in it, and we know that sugar isn't healthy. And so to have someone that's taking this type of diet and try to change them radically is a hard thing to do. I think the likelihood of success is not great. I think what you have to do is you have to educate. You have to educate them about the realities of our food system and what's in our food. Once they know that, then they have to make the decision that it's right for them. And then you have to basically wean them off of this Western diet, which is heavy with meats, heavy with oil, heavy with salt, heavy with sugar. And when you do that, you start to see a reversal of all of those conditions that are secondary to that type of diet. The hypertension, the diabetes, the cardiovascular disease, all of that starts to improve. And I think that once people can see the proof of changing their diet, then you don't have to force them. They can see it and they will do it for themselves.
I got to add to that because I think we definitely come from different places. People come to me who are already sick and motivated and ready to go, or they need my help to get motivated, to get ready to go because their life is in danger. So while I suggest in general terms that if someone is not currently dying or suffering, add what you're missing and then wean yourself off the rest. For some people, this is life or death. And so we can't give them the, like if they're coming to me and they say, tell me the truth about what I need to do, I'll say, listen, for you, if you add what you're missing and start weaning yourself off, you're going to do great. For other folks, like in kidney failure or lung failure or liver failure, I'll say, listen, the only real path we have to get you on your feet as quickly as possible is pure hypernourishment. Let's get you support you need to get that done so we can save your life. And I have a different, I think a lot of reason why people connect with me on this is because I was sick for so long. So having been a patient long before I was a doctor, I understand the fear. I understand what it takes to make these decisions and choices because I did it myself. I was a food addict. I ate macaroni and cheese and cheese and egg bagels every day. I know what it takes to get there. And I'm also able to motivate them in a unique way because I know what it takes to get there. And I know what it's like to be in the prison of illness. And it's a prison that only you had the key to release yourself from. So I never underestimate what someone's willing to do. I find out what support they need to help them be there. And for some people, they just need the information. Here's your diet plan. They do a wellness appointment, 75 minutes. I figure out their problems and I give them a plan to follow and they do great. Some people like Diane, she was able to read my book and do it on her own, and not need any support. And then for others that have depression, anxiety, trauma, food addiction, they need more help. I mean, the reason I developed things like my rapid recovery group is not because we don't ever like to take a day off. It's because we know that if we're there for people every single day and hold their hands and help them solve their problems, if they go off plan, I help them psychoanalyze. What is it that tripped me up? How did I fall off plan? What did I tell myself? What was I feeling? And help them solve the emotional triggers even as they keep going. Then they are able to do it and they are able to change their lives. So I think that what we really need to do is give people more support. And so that's something that I've just developed as part of how I function in my work, is that I give people daily support. Every one of my clients gets my cell phone number. I actually answered some questions while I was on. If people need me, they can reach me. And I know that's a very different way to operate, especially as a physician, but that's the way I've found I've been able to get people to do even extreme changes in their nutrition successfully, is by just increasing the support that they get to make sure they can do it.
I totally agree with that. I think illness is a motivating factor. I mean, we will do just about anything to gain our health, but unfortunately, we usually wait until our health is in jeopardy before we try to do those things. Too many of us are overweight. Too many of us have hypertension. Too many of us have cardiovascular disease and are not willing, at least at this point. And I think it's because of lack of awareness, lack of education, and sometimes lack of access. And so we have to look at all those things when we're trying to motivate the masses. We don't want anyone to get to a situation where it's critical, where it's life and death.
Absolutely. And, there's, unfortunately, people have to go to places like where we are now to even hear these conversations, because it's not part of the general conversation that people get when they go to the doctor's office, unless they're seeing someone like us, right? So, I have testified to the USDA Dietary Guidelines Committee multiple times, and I've poured my heart out into trying to get them to look at food in terms of human health rather than lobbyists and financial things. And it's going to take time, because even it doesn't matter. I testify, and right after me, there's the Alcohol Association telling you exactly how much beer you need every day. And then there's a sugar lady with candy cane earrings coming in to tell the Dietary Guidelines Committee exactly how much sugar people should have. And it all seems like it's all the same, right? And so it's going to take a really long time for this to change from the top down, but it can change from the bottom up. And it's conferences like this. So thank you, Stephen, for giving us these voices to be able to share all this. And it's all of you health missionaries, like those of you who've been posting the comments about the results you've been having. It's why I post on social media every day to keep people motivated. I don't know how many times I have posted a post about keep going, don't give up on yourself. And someone said, thank you, I needed this. I was about to go off plan and you saved me. And that's the reason I keep boasting, because it's just like, I feel the need to just be there for folks. I'd rather not. I wouldn't do social media if it wasn't for you guys. I would just like hang out more, do other things. But I just feel like people need that voice to say, yes, you can. Do not let anyone underestimate you or what you can do. Don't underestimate yourself. One story I just thought of off the top of my head. So my original goal was to work with the homeless. I've always wanted to help the people that nobody else was there for. That was my goal. And so I was a medical director at a nonprofit, working with 18 to 25-year-olds coming out of foster care and juvenile justice and homelessness. And when I got there, the doctor who used to be the director before me, he used to have a drawer full of candy. And so when the patients would come in, they used to open my drawers. And I was like, what are you doing? And he said, we're looking for the candy. So I would bring with me a huge tray of cut vegetables of every kind and a bowl of guacamole. And I would invite them to come and eat with me, because kids that age, actually, they're not kids, but they're very wary of doctors in general. And some of them didn't want to talk to me, but they were curious. I said, I have nature's candy for you, every flavor, every color. And I was told by the clinical director that there was no room for that in this clinic, that those patients would not be interested. These are 18 to 25-year-olds. A lot of them were involved in gang violence and have been in prison and all that stuff. And they said, nobody cares about this. And I said, I don't believe that's true. I think nobody's cared to teach them. So I didn't torment them with it. I just offered them to share my food with me. They didn't really want to sit and have a therapy session, but they were happy if I was willing to take them out to lunch. So I'd take them out to lunch. I'd help them move their stuff. I had a Jeep and I would move their stuff to the next shelter and just hang out with them and just be an example for them. And what ended up happening is they started requesting that we help them with getting produce. And so we used to have Friday meetings where they would serve pizza. They said, can we have smoothies like Dr. Brooke? And I said, yeah. So the nurse brought in a blender and they started learning how to make smoothies. They used to get, for attending classes, they used to get little cards that they could use to get pizza at the corner shop. And because they were so inspired by what I was doing, we actually developed a relationship with a local farmers market where they could use their credits for coming to class to go buy produce instead. And they all preferentially went to the farmers market over going to the corner. And this is in more of a food desert areas in Long Beach, California, where, you know, if you just went one city over, you could be in Orange County and see all the different things, but, you know, not so much in their neighborhoods. So I've always believed that, you know, if we live by example and we speak our truth and we never underestimate people, that we can help people really embrace this, that it's not something that people can't do. They can, and we have to believe in them so that they can believe in themselves and go after what really is going to give them the life that they deserve to have.
What you said made me think of the what happened in Brazil and the fact that they came up with this whole classification of food. It's called the NOVA system, and it's group 1 are minimally processed foods or natural foods. Group 4 are the ultra processed foods. And it's a real simple thing, unlike our dietary guidelines, which can be confusing. This basically says, limit or avoid the ultra processed foods, focus on the natural or the minimally processed foods. And kind of similar to what you described with the students, people, once they understand that and it's not confusing, we make food and nutrition and dietary exercise very difficult to understand. And that confuses people and they don't know what to do. And so when they don't know what to do, they do nothing. And so simplifying things for people, leading by example, I think is great.
What information are mainstream doctors telling women that you disagree with?
How much longer do we have? First of all, I just want to give a shout out to doctors in general. I feel bad when people come down on them. I have for just doing what they're taught to do. You know, I always say, if you go to a chiropractor, expect an adjustment, right? And if you go to an acupuncturist, expect needles. If you go to a doctor, expect a prescription. And I think people expect doctors to be able to do things that they weren't trained to do. I know for myself, I was not trained in nutrition. I was a genetic scientist before I became a doctor. And so my understanding of the cells and cellular nutrition helped me take what I was eating and turn it into a protocol, right? But we were not educated in these areas. We took the time to learn about it outside of it. And I didn't even plan to. It's just when my lupus went away, I felt a responsibility to understand why, because instead of being dead right now, I'm here feeling good. I was told I could never have children. I have 2 healthy boys. I saw one of you say you bought Solomon's book. That's cool. But you know, that I'm able to be here because of what I learned. And so then I had to figure out why and what it was. And my husband always says you have to save your wife. And I always say you have to save your life, right? So we are very motivated to learn and understand these things. But doctors don't know what they don't know. And if I hadn't gone through what I'd gone through, I probably would be shrugging and thinking, you know, why are people asking me about kale? Just take your Plaquenil, right? Like so I just want to say that as out front, that I don't hold anything against docs who are just doing what they're trained to do. I am really grateful that times are changing. And I find the medical students now are pushing this. Like I have been interviewed by podcasts from medical students in Australia who want to teach about plant-based nutrition and health. Wayne State University, the medical students developed their own plant-based club where they themselves made a chapter of research all showing the benefits of plant-based diet and health, brought it to the administration and asked for a class. The administration said no, because it's not on the boards, which how can it be on the boards if it's not taught, right? So they themselves started their own organization at the medical school, and they bring in speakers to teach them outside of what the school itself offers. And so I was able to go there and teach them. So it is changing. And I just want to say that for people who, I think oftentimes people will tell me, I hate doctors, no offense, I like you. And I say, listen, they're all trying their best with what they know. But there is the problem is that because doctors aren't trained in nutrition, and after goodness, you know, in order to become a physician, you need 4 years of college and be able to pass the MCAT and all your sciences, right? And then you need to have 4 years of medical school. Then your residency is a minimum of 3 years, but for most of us it's 4 years or more, right? So they are so trained that I think that sometimes there's a belief that settles in that if it was important, you would have learned it. And so therefore, whatever. And then they also kind of will believe that they understand things without results. And that frustrates me a lot. So I think that the number one thing that frustrates me about anybody giving recommendations about diet is oftentimes they're based off of what they think rather than what they've tested. And this happens even in the plant-based world as well, where people will make kind of a generalization about food that these are good or these are bad, especially fats, you know, putting them all in the same category. And it's based off of a belief system they've developed, but not necessarily something that they've tested specifically. And I only report on the results I have personally achieved. I never report on, this is what I think based on that. I just think that that is ethically a disservice to people. As both a physician and a former patient, I just do not believe it's ethical to give people advice on what they eat without having tested it and know what you're talking about. So that part really bothers me. There are also diets doctors will fall prey to any fad diet just like anybody else because they're not educated in it. So like recently I was on Fox News talking with another doctor who's a keto guy, and he's like, it works, all my patients lose weight, and you're hurting your patients by not telling them that this way that lose weight where they can eat butter and cheese all day. And, you know, he's a Harvard educated doctor, and it was making me sick to my stomach. And I said, there's lots of ways where someone can lose weight while increasing their risk of cancer and heart disease and autoimmune disease. I mean, you could just tell them to smoke cigarettes, they'll lose weight and they'll have more cancer and heart disease, right? That we have to really, be wary about what we teach people and make sure we're speaking from our real experiences and not off of like an Instagram meme or something we read that we then developed a theory about. So I think that is definitely by far my number one issue, is that I find myself having to deal with questions from people where somebody else will say something contrary to what I'm teaching, but they don't have results to show that what they're saying is true. So I feel like as doctors, we really need to do that. We have to be okay saying, I don't know, right? Like if you ask a question about menopause, I'm not answering that question. You have a professional, brilliant doctor right here who knows that answer, because that's what she does all day, is help women with their gynecological health. So she's the expert. I'm going to zip my lips and let her say, like she knows those things. I'm not going to make that up based only on my own experience with menstrual health, right? So I think that as long as we all speak from our experience, then we are always going to be giving people the best possible information.
Yeah, I agree. I think that doctors and patients are both trained to think that the answer is either a pill or a surgical procedure. And that's our expectation. So I think we need to revisit the whole role of food. We need to see it. I think we all believe that eating well is good, but the idea that food can be healing is radical. And so that's the part that when people start to understand what they eat has a direct impact on their health, then we're headed in the right direction.
Okay. What do you want to say about the consumption of fish, 1, the consumption of dairy, 2, the consumption of salt, 3? Fish, dairy, and salt. What do you want to say about that regarding our health?
All right, this is what I teach every day. Okay, let me start with number 2, just no, all right? Dairy is one of the most inflammatory things that people consume, and it has direct negative effects on their health, whether it's autoimmune or their cholesterol, on type 2 diabetes. It is just absolutely not food for humans, and it needs to go. So that's one that I could just give it just a universal, like, thumbs down. Let's just take that out. Fish, fish is one that they have swum into a lot of healthy diets, but I don't agree that it should be there. And I think, the proof is really happening more and more. A lot of times research catches up with what we are doing in practice. Like, I work with so many people every single day, and so what I'm seeing every day, I can't even begin to share versus, what they're doing in labs and studies. But I thought a really, really great study that came out that I think shows the truth about fish was the study that was published in the British Medical Journal looking at COVID and diet, which I thought was wonderful. This was before vaccines and treatments came out. So they were looking purely at COVID and frontline providers, so doctors and nurses on the front line dealing with COVID, and what they ate and whether or not they got COVID and whether it was moderate to severe. And the 3 diets they looked at is people who identified as, well, 4 really, standard American diet. They looked at people who identified as plant-based or vegan, no specifics about what they ate, people who identified as pescatarian, and people identified as high protein, low carb, so like keto or paleo. And what they found was, and it was really shocking, I did a lot of news clips on this because it was just so profound. What they found is people who identified as plant-based or vegan had 70% lower rates of moderate to severe COVID, 70% lower than people who ate the standard diet. That was shocking, right? Then they looked at pescatarians who don't eat any other meat or dairy, but plants and fish, right? And they had about 50% lower rates of moderate to severe COVID, right, than the standard population. Then they looked at the people who were high protein, low carb, so basically lots and lots of meat, not much plants. And what they found is those folks had almost a 50% higher rate of moderate to severe COVID, higher rate than average. So it was really, really interesting study. And what the conclusions that they drew were people who are plant-based eat more vitamins and minerals because that comes from plants, and those are probably protective. Again, you have to be careful about discussions and conclusions that are drawn, right? But what I found really fascinating that they didn't even address in the discussion was look at the difference in immune function between someone who eats only plants. 73% was how much lower their rate of moderate to severe COVID was, only plants, versus a pescatarian who was better off than everyone else, 50% better, but not as good by a long shot as plants alone. So there's a lot of folks out there who are trying to say that you need to have fish as part of your healthy diet. But what that study and what my experience has shown is that people who eat fish have less healthy immune systems and less optimal health than someone who eats plants alone. People who eat only meats, those guys are really sick. And actually, one of my husband's good friends died of COVID early on. And he is someone who is a very famous fitness guru who ate a high protein, low carb diet in his 50s, wife and kids, really great person, but ate this high protein, low carb diet and thought he was healthy, and he quickly died from COVID. And so, you know, when I read that study, I thought of him, that there are people walking around who think they're healthy because they got a 6-pack because they're eating that high protein diet, but their immune system is not healthy and they're in severe danger. So that's how I feel about fish. Don't do it. All right. If you're doing it and no other meat, you're still better off than the meat eaters, but fish is not a vegetable and it's not helping you out. It's better off to just eat the plants. Salt. Yeah. So again, my feelings about salt, well, they're not feelings. My directions about salt come from direct experience. I have not found that eating salt has stopped anyone from reversing their disease. What I have found is people hydrate themselves, but don't eat enough salt, they get really dizzy because they're dropping their blood sodium levels. So for people who are hypernourishing with 96 ounces of water or more, I don't recommend people go over a gallon without me watching over you. When you're drinking high levels of water, you do need some sodium in your diet. One, it's a great way to get iodine. Two, your kidney's job is to concentrate your blood and your urine. And so if you have a ton of water and not enough sodium, you're just going to lose all that. Your body's going to just dump that water out. You're going to be running to the bathroom, trying to get rid of it and feeling dizzy. So I do think that the negativity around sodium came from the fact that most people are dehydrated, and you take someone who's already dehydrated, you give them sodium, their blood pressure can go up. They have all these other issues. Someone who's hypernourishing and well hydrated, it's actually an important part of the diet and it doesn't cause any problems. And like I said, thousands of people I've worked with, I've never had that be a problem at all. Low sodium tends to be more of a problem than adequate sodium intake when you're eating in that way.
Okay, so I say that you have good, better, and best choices. I think by far the best diet is a vegan diet. I think that intermittent fasting, helping to detox the body, is actually very important. But that being said, I go back to you have to meet people where they are. And that I would suggest that the easiest thing to do is to tell people avoid ultra-processed foods, focus on natural, minimally processed foods, and then as they get better, as they heal, they can improve their diets.
Okay. And how often do you treat with lifestyle versus with pharmaceutical drugs and surgery? In other words, I don't want to mislead people to think that as long as you eat a whole food plant-based diet and exercise, that it's all you have to do with some sleep and water and you're fine. I would like that to be the case, but I don't want to make this more than it is. So in reality, how often do you feel that lifestyle alone gets people to optimal health, and how often do you need medical intervention of drugs or procedures?
If you're sick, I think you need to do whatever it takes. The only reason I'm sitting here right now is because of Western medicine. I was told at 16 that the doctors thought I had 6 months to live at best, that the most I could hope for was dialysis, but I might not make it. That's what I was told at 16. And thankfully, my doctors were extremely aggressive. I mean, I took 7 different medications every day, and I took chemotherapy in order to save my kidneys and save my life. So it's one of the reasons why I became a physician, was because I was inspired by the people who had the knowledge and dedication to really do everything it took to be there for me and to save my life. Now, that did not get rid of lupus. I still had it, and I continued to develop issues over my life, and I still had to continue to take medications until I changed my diet. When I changed my diet, all of the lupus antibodies disappeared, my kidney function went to normal, and the blood clots went away. So I have been able to be off all medications and have normal health ever since I changed my diet. So I think that we have to use whatever it takes, though. I have had people come to me who they don't want to take any medicines and they only want to do it naturally. And I'll tell them, listen, right now, your life's in danger. Your kidney function's failing. This is happening. This is happening. Let your doctor help you stabilize while we get your diet set up, because it's going to take time for the nutrition to start working on repair. So I'm very much a whatever it takes person. I am not anti-medicine in any way. Sometimes I have patients who'll brag to me that, I won't even take an ibuprofen if I have a headache. I'm like, really? I do. Like, I don't want to walk around in pain. I got stuff to do, right? If I sleep wrong and my neck hurts, I can't, I'm going to take something for it. So I am not anti-medicine in any way. I am a whatever it takes person so that you can live the best possible life you can. If you're currently sick, medications might be important. The problem that's happened is that we have relied on medication without using all the other knowledge that we have, like nutrition and lifestyle, to actually eliminate the disease or at least slow it down and allow your body some health. Most folks who start out on medicines collect them over time. Most people who are in their 60s are taking multiple medicines, and if they're not taking multiple medicines and they're taking a million supplements, which supplements are medicines in my book. They are interacting in your cells, trying to force your body into a state that it's not actually in. And what we need to do is optimize our nourishment, our emotional health. We need to exercise, we need to sleep, right? All those things to optimize our health. But there's nothing wrong with also using medication if that's going to keep you stable and keep you alive long enough to get there. I will tell people all the time, they're not sticking with their diet yet, right? So we're still working on the emotional stuff to get them on the diet that they need to reverse their disease, but they don't want to take medicines. And I'll tell them, listen, if you don't choose nutrition and you don't choose medicines, you're choosing illness, right? You have to do whatever you need to do to get through this. I saw somebody earlier talking about depression and how exercise is a great antidepressant, which is 100% true. But I've worked with people who were so depressed, they couldn't get out of bed to turn on a blender to make a smoothie. They could not get out of bed to exercise. They weren't even walking out of their room. That person needed antidepressant medicine to get motivated enough to get out of bed, take a shower, and go into the kitchen. Now we can turn on the blender. Right. So then I was able to get the person off of medicines once we got their lifestyle healthy, but without the medicine, they wouldn't have gotten there. So I think that there's room for everything. I think there's room for doing whatever it takes. And you should be open to just having the best health and life you can, rather than I'll only do it this one way or another way.
So I saw literature about the reversal of end-stage cardiovascular disease, and I thought that's incredible, phenomenal. How is that even possible? Then I saw information about the reversal of thyroid cancer with a plant-based diet, and I thought that's phenomenal. And then the question was, why can't we reverse gynecological issues with plant-based diet? If we can reverse all these things, why not a plant-based diet for GYN issues? Reality to date, I know that if a woman has dysmenorrhea, severe cramps, I've seen I'd say 100% approval just for change of diet. If a woman comes in with a large fibroid tumor, symptomatic bleeding, I have not seen a complete reversal, meaning a shrinkage of the tubes of the fibroids with a plant-based diet. I think with fibroids, the key is that you have to be proactive, meaning that you don't want to wait until they're huge and she's anemic and all these problems. Once you identify it, and you should do it proactively, then you put her on a diet, and I think you'll get a better solution. There are other GYN conditions like polycystic ovarian syndrome, improvement with diet, endometriosis, improvement with diet. But then the confusion comes in that there really isn't enough studies. There are not enough studies to really show that there's a clear benefit. And I think that's a deficiency that needs to be addressed in the future.
That's so true. I've actually gotten to see some really cool reversal. I'll have to share with you because a lot of folks come to me for, of course, autoimmune and other issues, but they also have fibroids and other problems, gynecological problems, and they've had reversal. We've had multiple people reverse PCOS, but this is pure hypernourishment, as well as dysmenorrhea and different kinds of, like, we have so many people because our group is 6 weeks. Most women who are having menses have at least one period with us. And we'll say, this is the first time I didn't have cramps. This is the first time I haven't experienced fatigue. So it's really powerful. And I think that this is part of empowerment of women, right? Is that we can do better and feel better. But you need your doctor too. I think we all need we need to be okay with taking all the help that we can get, especially when you're on the journey of learning how to eat better. Your doctor is going to be someone who's a really important part of your life.
Absolutely. And I think that's part of the problem. I think a lot of doctors don't necessarily believe that food can make a difference. Mm-hmm. And because of that, they don't advocate it to their patients.
Plus, they're addicted to all the bad stuff, just like doctors used to smoke, right? your doctor's probably grabbing a hamburger and he doesn't want to think about the effect of his diet on his health. So he's not going to bring it up to you either. So I've actually, a lot of doctors who are sick will come to me because they really understand that I'm going to look at like the cellular basis of their food and help them with that. Even plant-based doctors will. And what I'll tell them is, listen, you don't have to be perfect to be a good person for your patient. Tell them that you're working on it too. And tell them, when I see you next time, you ask me how I'm doing on my diet and I'll ask you how you're doing on your diet, and we'll check on each other. And I think it is a beautiful thing to be open as a physician and say, here's who I am, here's what I'm working on, here's what I know. And we can have a different kind of relationship that way.
Absolutely.
Thank you. Okay, I'm going to take questions. Before I take questions, I just want to say to the audience, thank you. This is the last of 16 panels. Tomorrow night, there is no panel. We really appreciate you supporting us and watching this conference. Also, we made the conference free so that this can reach everyone. The conference is free. The replays on our website are free. YouTube is free. The podcasts are free. However, we did that so this could reach more people because it's so urgent. If you have the ability, please join our $7 a month premium membership club, because that will allow us to continue to putting on conferences going forward. Thank you. Okay, everyone, one question, please. One direct, fast question so we can get to a number of people. Parn, would you like to ask a question, and where are you from?
Hi, Dr. G. Hello, everyone. I'm from Toronto. I have a question for Dr. G, I think. Is it okay for Lyme patient, chronic Lyme patient, one of my friends, can I suggest your protocol? Because I haven't seen too many videos or too much information on your site, but it's also said that chronic Lyme patient have some autoimmune component to it. Is it okay for me to recommend this diet to that patient with a little bit of GI issues?
Yeah, absolutely. So I think I saw you on Thursday too, right? Yeah, so absolutely. We have had great results working with people with Lyme because they do have very similar symptoms. One video by a woman named Becky that you can find on my YouTube, she had Sjogren's and Lyme and was able to reverse her symptoms. So, we haven't seen people who have tested all the markers, and sometimes with chronic Lyme, you can't even find markers. But in terms of optimizing recovery, cellular function, immune function, then it's always going to be something that's helpful. And we have seen people get really, really significant symptomatic relief using hypernourishment for Lyme.
Joanna, would you like to ask a question, and where are you from?
Hi, yeah, I'm in Central Oregon. I had tried going all plant-based, and by 6 weeks in, I was like exhausted. I just needed meat, even though I was trying to take vitamin Bs and things like that. Can you speak to that? Because that's like a constant discussion in people, like in social groups and Facebook, about meat versus plant-based. Like, can you go without meat, and how do you do it?
I can definitely speak to that. So what I see often is that the conclusions people draw are incorrect and lead them astray, right? So if you had fatigue 6 weeks in, I can guarantee you it wasn't a meat deficiency, because there's actually nothing in meat that's biologically necessary for us, and actually it's detrimental for us. So there was some other cause, but you didn't know what it was. And so that got you where, that was the conclusion that you drew. And that's not uncommon. I mean, I think the majority of what we do in my rapid recovery programs, I'm working with people every day, is help them not believe their own conclusions. Because
yeah, it was hard because I felt like as soon as I ate the meat, I felt better. So something was out of balance.
So I don't know what it was, but what I'm saying is it's not something that you needed meat to fix. I can't analyze it because I don't know what you were eating. And that's one of the downfalls, I think, is that there's so many different ways to eat a plant-based diet, and not all of them are equally healthy. You're not going to get the same benefit eating just like rice and beans as you are eating like salads and smoothies, right? There's just no chance that the nourishment is nowhere near the same. So it might have been really a nourishment issue versus the meat issue. And it also might have been transient. So sometimes people will go through these kind of like I call it like shedding the layers of the onion of inflammation, where they might have like a little bit of time where they feel kind of under the weather or flu-like, which is coming right before the real rising of the energy that's after that. And they'll kind of cut themselves off. They'll abort like that. We call it detox, but that's a word that people have arguments about. Well, whatever it is, they cut off that process and they prevent themselves to getting to the other side. So when I'm working with someone, I can watch and see and go, your nutrition is great. Keep going. All right, this is exactly right. This is going to pass. You're going to be fine, right? Or I could look and say, oh, this is what you're eating. Listen, you're actually low in your nourishment levels. Let's increase this, this, and that and get you there. Like I said, even things like hydration can make a difference. So what I would just suggest is let's let go of the conclusion that it's a meat deficiency, because it's not that. I've helped people who have told me the same thing many, many times. And instead look at, let's get your nourishment levels optimized, like hypernourishment, and stick to the plant-based, and then see if that happens again. And if it is, then that would be a great time to check in. Like if we had an appointment and I spent 75 minutes with you going over everything you ate and everything going on in your life, I'd be able to pinpoint it. They won't let me do that here. But you know, there is something there, and we just need to identify what it is. But don't give up on the plant-based eating, because it really is optimal for your health.
Okay, thank you. Appreciate that. Yeah, I think probably it was the latter, the sort of going more in the directions of the beans and rice type thing.
Yeah, I'll see that a lot, where someone, when they're eating meat, they do like meat and vegetables, but then they switch to plants and they go, okay, beans and rice. I'm like, where are the vegetables? Right. So, you know, sometimes that's it. But yeah, hopefully that helps you.
Okay, thanks so much.
Bridget, would you like to ask a question, and where are you from?
Yes, thank you. I'm from Saskatoon in Canada, and I'd like to ask a question for Dr. Goldner. A couple of years ago, I got an ANA of 1/160. Then a few months later, 1/80. And then COVID hit, and then my doctor went away. So I have a new doctor, and he says it's nothing to worry about because I'm not symptomatic. Is that correct?
Hold on. I just swallowed wrong. Why did you test it? Excuse me. What were you experiencing that made you test it?
I had pneumonia, and I had a high C-reactive protein, and I think my doctor just threw a bunch of tests in because she was worried about this C-reactive protein. So
yeah, and you know what happens is, I remember when I was doing my rheumatology rotations, they would get so angry when the doctor would test an ANA without cause, because they didn't know what to do with it. So generally, rheumatologists do not consider an ANA to be positive until it's greater than 1/160, because there are people walking around a 1/80 and 1/160 that don't really have any kind of rheumatological symptoms or issues. So on the one hand, it went in the right direction, so that's cool, but it's not, I agree with your doctor that it's not really a number that you need to worry about. Rheumatological conditions are really diagnosed based off of a combination of the labs and the symptoms. And to me, the symptoms are more important as far as how their health is going than even the numbers are, because it doesn't always match up. But I would say if you feel otherwise healthy, I wouldn't worry about that number. I would still take great care of your health, knowing that you potentially could have an ANA progress. You still want to eat really well, but I wouldn't be concerned just with that number alone.
Carol, would you like to ask a question, and where are you from?
Hi, it's actually Craig Van Tynen. That's my wife had signed up, but I'm a psychiatrist, a doctor from Vermont, and I have some questions for Dr. Goldner, or a question. So basically, I've been on a plant-based diet probably 15 years since reading Colin Campbell's book back about 15 years ago, which I think is a great contribution to the field. Without a doubt, it fits right in with the Asia having increased autoimmune problems nowadays. But what I really wanted to get at is I had a small stroke probably, well, it's almost a year and a half ago. And it wasn't due to cardiovascular. The neurologist said that they looked great, but it's because I have AFib. I didn't like being on a blood thinner, and I kind of avoided it for a while, but then I got this small stroke. So I'm taking meds, even though I've been able to get off most different things. I wondered if you have any experience or knowledge of AFib regarding the hypernutrition and any responses that way, or any advice. And I have a slight question too with Dr. Greger, who I really appreciate from nutritionfacts.org, has brought up that he feels that from the study he looked at in May 2019, that more than a tablespoon and a half of flaxseed has the risk of having more or a high exposure to arsenic. And I don't know if you had heard that at all. So I guess two questions.
Okay.
Yes, go
All right.
ahead.
Well, I'm glad that you overcame that stroke and you're doing okay. First of all, it's a scary thing to go through. Two, we have had people with AFib that have really have reported that they have had improvements in their EKGs and overall health. Of course, it's great for the cardiovascular system to do hypernourishment. You do need to be careful, though, if you are taking warfarin or Coumadin, that you are checking your INR and making sure that your diet and your medicine are corresponding correctly, right? And if you're taking something else that's not diet, doesn't get affected by diet, that's okay. So hypernourishment is definitely a great thing to do for your cardiovascular health, in addition to taking your anticoagulants. And it's also really important. I mean, omega-3 fatty acids, they are an important part of your nervous system. They're the main component of the membranes that line the neuron cells, right? So, and it's an important part of recovery as well to add the omega-3s. Listen, I'm friends with Dr. Greger, and we've talked a lot about things. I actually did see the study he was talking about, but the conclusion of that study was, so what they did is they looked at people eating, they said there's a microscopic arsenic component, right, in flaxseed. So they said, how can we get that to even be significant? And what they found is people had to eat a half a cup of flax seeds plain with nothing else in their stomach, and they could get some measurement of a blood level of arsenic when they did that. And even those people had zero symptoms of toxicity. So that is not really, that's what I was saying, that, studies are not about real life, really. So first of all, I don't know anyone who sits there and eats a cup of flax seeds on an empty stomach. Two, it still wasn't clinically significant because those people did not have any kind of signs or symptoms of toxicity. So I think that actually rather proved the safety of it rather than the opposite. The other thing I can tell you is after almost, like I said, 2 decades of giving people super high doses of omega-3s, primarily through things like flax seeds and chia seeds, we have never once had somebody have any kind of toxicity from it. And in fact, instead, we've just reversed all of these different diseases in thousands of people all over the world. So I would say that the evidence is actually really good, that the benefits from the omega-3s are outstanding, and that the risk of any kind of poisoning is mostly theoretical and not something that's actually happened in real life.
Lisa, would you like to ask a question, or where are you from?
Oh, hi. I'm from Edmonton. Dr. Goldner, I had a question for you. From your talk on Thursday, you mentioned somebody had corrected or reversed their glaucoma. So is glaucoma an autoimmune disease?
So we've actually had 2 people do rapid recovery for glaucoma that reversed it. One was a woman that had already lost sight in one eye, even after surgery that didn't work, and she was starting to lose the vision in the other eye. And during rapid recovery, she actually not only reversed the one that was starting to get sick, but she started being able to see light and dark in the other eye that had been completely blind, which was awesome. And then the one that I was mentioning there, a 77-year-old man who had glaucoma, and on week 5 had a normal eye exam with no glaucoma. Now, just because something gets better in our protocol doesn't mean it's autoimmune. It means it's inflammatory, right? So remember, the protocol is not specific to disease. It's specific to cellular repair and optimal immune function. So we have found that people with many different eye diseases, uveitis, glaucoma, Graves' disease-induced eye problems. Even there was a disease I'd never heard of in medical school called birdshot uveitis. I've now helped 2 people reverse it. It is completely rare, but guess what? It responds to hypernourishment. So just because something responds doesn't mean that it's autoimmune. We've had people reverse heart disease in days, diabetes within 4 weeks, right? So it really is just optimizing cellular function, and that's going to be beneficial for everybody.
Perfect. Thank you.
Mm-hmm.
Sherry, would you like to ask a question, or where are you from?
I sure would, thank you. I'm in central Delaware on the east coast of the US. My question is for Dr. Abdul-Rahman, and I hope I'm pronouncing your name correctly.
Close enough.
The reason, tell me, can you repeat it for me so I'll know?
Abdul-Rahman.
Okay. A point was raised earlier in the evening, only briefly, about there being chemicals in our environment that are endocrine disruptors.
Yes.
Now, I follow the environmental working group quite closely, and they have a database that you're probably familiar with that goes through the chemicals that are in various cosmetic preparations. And the reason I selected you to answer my question is because given that we are both women of age groups that are heavily targeted for skincare products, I wondered if you have feelings about any particular chemicals in skincare products, and you don't have to call out the names of what you use or not, that's fine. But if you have some thoughts about chemicals to avoid, because I know I love to take care of my complexion. I've sometimes made some of my own products, especially with jojoba oil, because it has a molecular size that is beneficial for the skin. It's close to being like sebum. But I wondered if you had strong feelings about that.
That's a great question. And I can't do this justice, but I will try by saying that chemicals are ubiquitous in our environment. They're in our cosmetics, they're in our foods, they're in food packaging, they're everywhere. And that's the result of our dependence on plastic. The chemicals are used in the processing of plastic to make it malleable, to change the color, to change the properties. And we as a society have gone from a society where things are reusable to now we're a disposable society, and we have a lot of single use of plastic items. And now we have a problem with abundance. They say that since 2000, over 50% of all the plastics that were ever produced were produced since 2000. And so now we have a problem of too much plastic, but greater than that, we now have plastics that are in our foods, they're in our bottle of water. And what happens is that we don't know the long-term effects of these chemicals. Unlike pharmaceuticals, they are not regulated by the FDA. Manufacturers are not required to label them. And so whether I say avoid phthalates or avoid BPA, another industry or another manufacturer can produce an equivalent and still not have to identify it. So it's hard to target which ones to avoid. We just know that it's impossible. It's impossible to avoid them. And we have to try to limit it by things such as we want to, if possible, go organic, because of the pesticides that are used on conventional foods can have these chemicals. We actually want to avoid canned foods if possible because of that. We know that in the packaging of fast foods that these chemicals are can leach into the food. They tested levels of these chemicals in the umbilical cord of newborns, of moms that have eaten high levels of these EDCs, and they're detecting it. And we know that they can potentially have long-term ramifications. And so it's huge. But women may be at an increased risk because we use a lot of products that contain these chemicals, like the cosmetics that you mentioned, like the hair products that I mentioned earlier. And so, and there isn't one specific way to know which chemicals you should avoid. Did I answer your question? Because it isn't possible for me to say avoid X, because tomorrow they may have an X derivative that's just as bad or equally or even worse. So it's not as though I can say avoid PFAS because there'll be another chemical that could be just as equally detrimental to our health.
Okay. Well, I know that you tried to bring in as broad a catch as you could, cast a very wide net there. Pardon me. One thing in particular that I see showing up in, for women who have a lot of sun exposure is hydroquinone. And so I was wondering about that. And another one, octubenzone, I believe it is, that's in a lot of sun protection products. And so I was hoping that if possible, you might address those.
So I am not possible, partially because the manufacturers are not required to list their chemicals. So just because you don't see something listed doesn't mean that there isn't something in it. For female hygiene products have these chemicals in it. I mean, they're everywhere. And so there isn't one bad chemical. And I guess that's what I'm trying to suggest to you.
Okay.
I could weigh in on skin health if you want.
If you
just
would,
a different
please.
perspective.
Yeah, certainly.
So the most important thing that I tell people to avoid that probably isn't talked about, I don't think these chemicals are as much of an issue as one, your skin is an organ and it's going to receive or not receive nourishment and hydration depending on what you consume, right? So the very last organ to receive nutrition and hydration is your skin. That's why most people who will work with me long enough, they all tend to start glowing. And it's this, that nice beta carotene tan of getting good nutrition and optimal hydration that actually decreases all of the different issues that you normally see in the skin. You don't have as much fine lines and wrinkles and all of those kind of things. And you have that general glow of health, right? The other thing I discourage people to do is use soap. I don't use soap. And I've found that, when you look at something like soap, one of the things many of them do is they disrupt the skin's microbiome. We have a microbiome not only internally, but externally. And when we have the right bacteria living on our skin, we have better skin health. But when we disrupt that microbiome, now we have all sorts of different problems. So the microbiome, our natural level of oils, soap removes that layer of oil that we naturally would produce. Then we have to put it back on with cream, but then they put alcohol in the cream to make sure that it dries you back out again. So you need more cream, right? So what I've always done is I just use coconut oil. The only makeup I wear is my lip gloss, blush, and eye makeup, right? I don't put anything else on my skin. And then I use coconut oil and I just remove the makeup with the coconut oil, rub it in, rinse it off with water. And then maybe I'll put some like vitamin E, maybe some vitamin C, if I want to put something like serum based or cream based on it. But that's it. I have found, as someone who used to have lupus with rashes and all sorts of issues with my skin, I have found my skin's been extremely healthy, just making sure I'm super nourished and hydrated and just leaving it alone. When I use soap in the shower, I use only olive oil soap. It's the only ingredient is olive oil that they've made into a soap. So no sulfates or anything like that. And so I find that really the key is nourish and then just like don't remove what was meant by nature to be there. That's what's worked for me.
So I would respectfully disagree with that to the point that we have microplastics in our water. And if we're hydrating and super hydrating, we're also drinking these microplastics. It's been documented time and time again. What we don't know is whether these microplastics that we are swallowing are getting absorbed into our bloodstream. And if they do get absorbed into our bloodstream, then they could possibly be then go to other vital organs in our body. And so it's not just hydrating and thinking that you're going to avoid the effect of EDCs. EDCs are just way too prevalent to be dismissive of them. And it's not, and even our so-called wholesome products, if they are manufactured, they may have chemicals in them that we are just not aware of. So unless you're making it yourself, it's not really safe to assume that you're not exposing yourself to these EDCs or that you don't need to worry about them because you're drinking lots of water.
So I do think it's important to separate out theoretical issues with actual issues that are happening. So for example, we do hypernourishment, high levels of hydration, people's diseases go away, their skin health, all the other organ systems come online, and their blabs look perfect. So we know in real people in real time the immediate difference it makes. If there was a case, because I'm always open to growing and changing what I do, if there were cases of people who were doing that and then they started having all these other issues that we could then identify was due to plastics or other issues, then we go, oh, we need to change this. So I think that it is an issue that's important and we do need to pursue it and then see real world issues that are happening and what the causes are and what to do about it. But I don't think that that removes the need to focus on what we know is working in the moment, which is that there's a huge detriment to people's health by being extremely dehydrated and extremely malnourished. And that's something we can do right now, even while we're trying to keep learning about all these other issues that are in our environment. I'm not saying not to address those, but I think that the proper nourishment and hydration, well, not just think, I know from results that really does take care of the problems for most people. It's kind of like, when people worry about, what about the effect of pesticides? I think it's an important issue. I don't want to eat pesticides, and organic produce is grown in better soil and has better nutrition. And at the same time, when I reversed my disease, I was a very poor intern and I only ate just regular produce full of pesticides and my lupus went away. So I learned that the benefit of the nutrition was outweighing whatever negative effects might have potentially theoretically happened from pesticides. So I still do recommend, if you can, go natural, go organic, but if you can, still do the things that your body needs for nutrition and hydration, because that's one of the most vital things to the health of your cells.
So I would just say to that, that we know that they're chemicals and we don't know the effect of the chemicals, and it's not a theoretical thing. The one chemical that comes to mind is DES, diethylstilbestrol. It was given to pregnant women to help them avoid miscarriages, only to find out that their progeny, their children, and now there's studies on their grandchildren looking at the effect of this chemical. And so we know that they are chemicals. And so even though we're not seeing an immediate detrimental effect, we can't assume that it's okay. And I'm not saying that we can't, I definitely think hydration is important. I'm not trying to dismiss that, but we need to understand that when we're hydrating, odds are we're also taking copious amounts of microplastics into our system. And how is that? And we need to address those issues. We need to know first of all, does it get absorbed into our system when we're adjusting it? And these are really questions that are not theoretical. These are questions that really need to be answered today.
Yeah, I think it's an important issue. And if we saw increasing hydration, increased health problems, that would be a problem to solve in my world, versus increasing hydration is removing health problems. Every aspect of their health is getting better. Then we can see in real time in real people that the benefits they're getting it's working, that it's beneficial, right? If that changes, then that makes more sense to say, okay, you know what? The potential risk is not worth the potential benefit. So I think that's what we have to always work in, is in real time, what's happening to people when they increase their levels of nourishment and hydration. Their health is getting better. Their organs are getting healthier. They're coming off a transplant list. Their glaucoma is going away. Okay, looks like it's working. Let's keep doing that thing that's working, even while we look to improve the water supply, improve the sources of produce, et cetera. I think both of those things are really important.
That's right. And the question is over what time frame? I mean, are we saying she got better in 3 months, but what happened in 3 years?
So far, 16 years and counting, it's only been better and better, but I will let everybody know if it goes the other way, I promise.
I mean, that's fantastic, but these are questions that need to be addressed now.
Of course.
Okay, so why don't we have each of you make a 1-minute closing summary final statement to summarize your final thoughts. Dr.
Well, I'd like to thank you, Mr. Shore, for even making this possible. I think it's a fantastic program. I think that women's health is a vital, critical issue. I think there are too many unknowns with women's health. I think there have been inadequate studies in the past. There are too many, and I think that nutrition will play a vital role, but we need to do the research to document it.
Thank you.
I just want to thank all of you guys for spending your Saturday night with us. That was super cool. I've had a great time. Dr. Abdul-Rahman is an awesome doctor. If she was in my area, she'd be my OBGYN. And thanks, Stephen, for inviting me to your conference and for all the time I've got to spend with all of you guys. It's really special to me to connect with people. And I got to say, during COVID, I've missed it. I've missed the connection. You know, whenever I go to a conference, I usually get like 100, 200, 300 hugs. And now, especially after COVID, I don't know if that'll ever happen again, but man, I miss it. So it's just so nice to see all of you guys and all of your comments. But what I would say is, listen, there is so much that you can do to enjoy your life right now, right? Because I think that's important, that we embrace and are grateful for every gift we have right now. And at the same time, do everything we can to optimize our health. And if you don't do it, if you're not motivated even just for yourself, remember all the people that love you, that need you to take care of yourself because they want you in their life, or they need the gifts that you were born to give. So I just hope that everyone who's been here, that you've learned something and that you've been inspired and that you're willing to just even start doing something better for yourself. You're going to be so glad that you did. So if I helped you in any way be inspired to do so, then I'm glad that I got to spend the time with you. So take care of your health, everybody.
Thank you.
Can we unmute everyone so we can all say thank you together?
Thank you.
Together.